How does E. coli cause UTIs? Imagine bacteria from your gut sneaking into parts of your body where they don't belong. That's exactly what happens with E. coli when it causes urinary tract infections. These infections are very common, especially in women, and understanding how E. coli triggers them can help you protect your bladder health. E. coli is a normal bacteria that lives in your intestines and usually doesn't cause any problems. But if some of these bacteria get transferred from your anal area to your urinary opening, they can cause trouble. This transfer often happens if hygiene habits aren't ideal, like wiping from back to front after using the bathroom. Once E. coli reaches the urethra, the tube that carries urine out of your body, it can travel upward into your bladder. The bacteria have special tools called adhesins on their surface. These are like tiny hooks that help E. coli stick tightly to the lining of your urinary tract. One important adhesin is called FAMH, which is part of the bacteria's pili, or hair-like structures. This sticking process is crucial because it prevents the bacteria from being washed away when you urinate. Once attached, E. coli can multiply rapidly inside the bladder. Some strains of E. coli are even able to invade the cells lining your bladder. They do this by entering the cells and forming protective communities called intracellular bacterial communities. These communities shield the bacteria from your immune system and antibiotics, making infections harder to clear. In some cases, the bacteria can hide inside bladder cells in a dormant state called quiescent intracellular reservoirs. These reservoirs can reactivate later, causing recurrent infections that can be frustrating and persistent. E. coli also produces toxins and other factors that help it evade your immune defenses. These toxins can damage bladder tissue, causing symptoms like burning during urination, frequent urges to go, pelvic discomfort, and sometimes blood in the urine. If the infection spreads to your kidneys, symptoms can worsen to include back pain, fever, and nausea. From a bladder health perspective, it's important to note that while most UTIs are treatable with antibiotics, repeated infections can cause ongoing irritation and inflammation of the bladder lining. Chronic inflammation may, over time, contribute to changes in bladder tissue, but current evidence does not show a direct link between UTIs and bladder cancer. Still, maintaining good hygiene, staying well hydrated, and seeking prompt treatment for infections are key steps to keep your urinary system healthy. Because some strains of E. coli are becoming resistant to antibiotics, prevention is more important than ever. This includes practicing good hygiene, urinating after sexual activity, and avoiding irritants like harsh soaps or chemicals in the genital area. Researchers are also exploring vaccines and targeted therapies to prevent or treat UTIs caused by E. coli, but these are not yet widely available. In summary, E. coli causes urinary tract infections by entering the urinary system, attaching to the bladder lining, and sometimes invading bladder cells to multiply and evade defenses. Managing infections early and practicing good hygiene can help protect your bladder health. If you experience symptoms of a UTI, it's always best to consult a healthcare professional for proper diagnosis and treatment. Remember, keeping your urinary tract healthy is an important part of your overall well-being.